There is a saying that he who knows it feels it the most, right? So I'm surrounded by a lot of people, friends, loved ones who have children with on the spectrum. Every day, autism is in my face. I see it from friends, from loved ones, and it gets into my head. And immediately I see it gets into my head, I keep pushing out the information. I'm not going to stop. One day you will listen to me because I'm exposed to this. It drives that passion.
I say it all the time, but for real, for real. Welcome to another great episode of Dre Smiley, The Inner Circle.
Right, for real. I love the way that you introduced with that, because this doctor we have on today is a for real global transformer in the medical arena. She was in Canada, she was in Nigeria, she's in Los Angeles. She's leaving her mark all over the world. So let me read her bio. Dr. Folorunso started her career in Nigeria as a registered nurse in 2010 before relocating to Canada in 2011 to embark on her Bachelor of Science in Nursing at the University of Saskatchewan, Canada, where she graduated with distinction in 2015. She obtained her Master's in Health Administration at the University of Regina, Canada in 2020 with distinction. Adeola, wow, that is amazing. So how did you get on the path of medicine and mental health?
I grew up to see all this. And I know that it is not an issue. A global health issue is not something that is limited to Africa. That's why it's called a global health issue. So I lived in Nigeria, schooled in Canada, and I also live in the States. And that I could see that it is still the same issue all across wherever you go, irrespective of who you are or your gender. So it just started from what I see. And as I grew up, it just keep expanding. And it's an area where people just need to pay attention, especially the policymakers, actually.
When you look at the mental health aspect, and even maybe we'll tie that into autism, do you find that in the States versus Canada versus, say, Nigeria, the autism rates are the same, or it varies?
Yeah, it depending on the angle where you're coming from. When you're coming from the angle of your social determinants of health, which entails your culture, gender, education, income. In North America, for instance, you would find that it is 1 in 45, thereabouts. And the gap keeps, it's kind of like becoming more. And in North America, boys are 4 times at risk of having that, right? But when you go back to Nigeria or in sub-Saharan Africa or in any African country, you will find out that the disparities are more, to start with, autism does not respect anybody. It doesn't respect age. It doesn't respect sex. It doesn't respect your social status, right? But the only problem is that in sub-Saharan Africa, where we try to shy away from that because of the stigma around that, there is a limited data to say these are the number of people actually affected. But what we do see is that the number is actually increasing.
A couple questions. I want to go back a little bit, but before I do, the stigma around autism. Tell me about it.
Well, the stigma is highly pronounced in Africa. And it's because of our cultural belief system where you have anything around mental health itself. Nobody wants to associate with that, right? That doesn't mean that in North America or in the Western world that there is no stigma around that. But it's not as pronounced as what we have in Africa because the people just believe that it's because you've offended God. You are not in the good book of God, and that's why you're being punished. And such people are being seen as, possessed sometimes. And so nobody wants to associate themselves with people who are possessed. It's still the same issue when I looked at the aspect of postpartum depression too, where women in Africa don't want to talk about it because what would the society say? How are they going to address them? And so people rather just keep quiet about it, and instead of looking for or going fordering for more intervention. So stigma is one of the big things why people are not accessing the care that they're supposed to at the early phase.
Dr. Folorunso, what comes to mind as you share that is how challenging it must be for you and others in the healthcare industry to help provide care, right? Because there's this stigma, they're ashamed. I think back about, you know, decades and decades ago, mental health and how there still is a bit of stigma around it, but decades and decades ago, there was a huge sense of, you won't ruin our family name. We have to hide you. And so, way back then, if there was a child that was severely challenged with some type of health issue, whether it's mental health or otherwise, they would almost shun them or put them in an institution and kind of assume that they didn't exist. So obviously there's no opportunity for care. And it sounds like that's kind of what you're facing here in some sense. So I'm glad you shared that. So let's back up now. Let's back up a bit. You clearly have a academic drive, right? You have a number of different degrees, so much so that the work you've done has been recognized, and you've received an honorary doctorate. Where does your drive for academic excellence come from?
I'm surrounded by parents, siblings, loved ones that they're in the academic environment, so you have no choice. It's a must. Wherever you roll with or wherever you mingle with, it's just going to be, you pick up the characters from them, right? But not just only that. As one grows up, you realize that for you to be relevant and for you to be valued at what you speak or whatever you want to do, you better have the right language for that. And so that's why I'm always putting myself into that space of going to learn more about something. And before I talk about anything, I want to know what it is. I want to, bury myself into that knowledge and have that evidence-based findings so that you don't put out the wrong information out there when you're talking about a particular subject matter. So the passion to improve health, the passion to be an advocate just puts me in the space that if I really want to be relevant in what I talk about, I better continue with that professional development. And that explains why.
Sure, that makes sense. Something we talk about on the podcast and I really believe strongly is exposure. Your exposure growing up can increase your horizon. It kind of helps define who you are or who you're going to be. Just out of curiosity, let's say, you mentioned that you're surrounded by high achievers, academics and the like, whether it's in the family, friends, that sort of thing. Let's just say that you went home and told your dad, you know what, I think I want to be an artist or a carpenter. What would their response have been?
First, my parents do not. They are very versatile and vast when it comes to career. So they will not even kick against that. But what they would tell me is that you better go learn the rope trade and everything. Learn the nitty-gritty of that. Be the best carpenter. So it doesn't have to be academics. You don't have to be for you to be relevant, it doesn't have to be all academics, but make sure that whatever you do it well.
I love that. So I love that. So their push for you wasn't, you have to be an academic. Their push, their exposure that they helped create for you was excellence, right?
That's perfect. That's right.
So whatever you do, be excellent. Is that fair to say?
That's it. That's the summary of it. That's it.
Yeah, I love that. Okay, so now let's dive back into where you are currently. Matermental. Tell me about that.
So yes, Matermental was founded last year and it's been doing amazing stuff, not because I'm the founder, but because of the feedback I've been getting from people. The feedback, So Matermental was founded because last year, there were a whole lot of people around me bringing, naturally, I find myself in the space of mentoring people or giving counseling. I'm not an official counselor, but I think by virtue of birth or virtue of who I am, I find myself counseling a lot of people, whether professionally or even outside my profession, and even the young ones, my contemporaries, or even people ahead of me. And so there were a lot of discussion around postpartum depression, and I had to go deeper and even bury myself into it to see what it looks like globally. And then I decided to streamline that to see what is even going on with that, like in my country, or even in Africa generally. The statistic that I saw, it was bad. It wasn't encouraging. So I organized a global summit on that, a virtual global summit on that. And so that's how Matermental started. And then when I finished that, I knew that was not the end of Matermental. Matermental must carry on because the goal is to impact life across the spectrum. That is the theme of Matermental. So to impact life. So it's a non-governmental organization, and it's non-gender, and it addresses global health issues. And so this year and next year, it's been focusing on autism, or mostly neurodivergent disorders, more specifically autism. And so it keeps unfolding. So I can't really say this is it, but Matermental keeps unfolding.
In terms of success with the organization, tell me how do you define that? And give me an example of some success you've seen since the genesis of Matermental.
My success will be mentioned based on the people who have accessed the program, because they are the true consumer of that program. So it's not going to be coming from my own perspective. It's going to be coming from the people who had accessed the program. And so last year, for the postpartum depression, a lot of people had access to psychologists, had access to public health experts, had access to mental health nurse practitioner, which normally they might not be able to have access to, or they might even have to pay, because access does not always mean location. Sometimes the finances too as well. But through this Matermental program, they were able to have that access to those evidence-based information. And not only that, even the people who attended also became volunteers because they wanted to carry on that work as well. They became volunteers that, wow, let's join the force. So to me, that's a success. And then to this year's program, which is the autism program, you need to see how the children were really happy. The smiles that came from the African kids in Nigeria, they were really happy. They were really excited. And the pictures, the pre-picture of how their dental situation was. And then the post just speaks for itself, because they're able to smile. And from smile improves your mental health, your well-being. You are able to, it even reduces the halitosis, that's the mouth odor. So they can speak in the society. They are not being neglected. So those are objective findings coming from the people who had accessed the program. And I believe that's how I'm going to measure. Those are my metrics.
What she said was so amazing is, she said, by smiling, you increase your mental health. It just makes it so you're happier and your health is there. And I'm smiley.
Yeah. So his mental health is on point.
So tell me, I'm so intrigued with autism, because when you hear it, people say, oh, he's on the spectrum. What is autism? They even say Elon Musk, he's on the spectrum. But what does that mean?
So to start with, it is a disorder. It is not a disease. It is a disorder, but it depends on which platform you want to come. But it's a spectrum, meaning that some could be, just very minor, some could be just in the middle, and some could just be severe. But what autism itself, by definition, it's a neurodevelopmental disorder that it affects social life, your social interaction, your communication, and your interaction with people. So some could be, when they're on the high spectrum part of it, some could be so good academically, right? And then, but behaviorally, they do not have a clue what is going on. They can just jump into a conversation without taking excuses. They don't know how to take turns, right? So, and some, they could be extremely communicative, like they really, really talk. And then in terms of, again, the social aspect of it, or the behavior aspect of it, it's not just, appropriate, right? So with the question, can you outgrow autism? Autism can be managed. That's the word. It's not a disease that where I take a medication or you do a blood test and begin to say, I saw autism, or like a bacteria that you see in the blood. No. It's not. It is a neurodevelopmental disorder, and it has different etiologies or different causes, right? It has been some school of thought that said it is environmental, it could be genetics, and most times when it's environmental, there's so many things attached to it, maybe exposure to chemical, so many other factors like that. So can you outgrow autism? It remains in a gray area, because just because it's not a disease that there is no medication for it. But what can be done is to be managed so that such person has a good quality of life. That is the goal. The goal is not to take it away. The goal is to manage it such that the person can have that optimum life and also be able to function, whether in their career, academics, or even in communication and even in the society. So when people come from the aspect of the strength base of autism and not the deficient base of autism, then that person begins to live that quality life that's that they're entitled to.
So is there an exam? You said it's not a blood test. Is it a brain scan you take and say, let's say I have 5 kids and one is different than the other 4. And I'm thinking, well, maybe he has autism, but I don't know.
Yeah, so it depends before, and that comes from the screening, before you can confirm a diagnosis, you must have done your screening properly. And when it comes to screening, there is the subjective part of the screening where we use the word symptoms. So symptoms is the subjective part of it, where what the person sees and other people cannot see. So, and then there is the sign, which is the objective part of it, where the expert can see, but most likely the person who is having that condition might not be able to see. So it's a mixture of objective findings and subjective findings. And part of the objective findings is where you run the test, to see, you might want to run a brain scan. You might want to run giving out different screening tools out there, right? For instance, there is the ASO part of it too, ASOD. That's what they mostly use for the adults. There are different schools actually, screening tools actually that could be used for that. And so it is so hard to say this is it's I don't want to use it's kind of like a trial by error, but once we begin to see the signs and symptoms matching, right, it's kind of pointing towards a particular diagnosis, right? So sometimes when they run the brain of somebody who has autism and the brain of somebody who is on the neurotypical portion of it, they believe that a particular portion of the brain is being pronounced than the other. And they also see in terms of the connections of the neurons as well. I mean, when we go into the neurology part of it, the connections of the neurons and the nerves, they see that when it comes to the people on the spectrum, there's too much, like sometimes it's just too much connected, right? It's not properly organized, right? Or so it depends on the school of thought on how the expert interprets the whole thing. But once you begin to see the signs and symptoms based on the scientific tools available, then you can begin to say, this is it, and find the intervention for that.
Makes sense. Question for you. One key to getting change, right, is policy. You mentioned that earlier. Talk to me about how you're getting this information to the policymakers so that they have a clear understanding of what changes need to be made so that these individuals can worldwide receive the care that's needed.
Yes. So when it comes to anything, you want to change anything or you want to change a particular subject or a particular issue, the first thing is to create the awareness of that particular thing, right? So what I've been doing as an advocate, I've been putting out evidence-based information out there to create more awareness. And when I create that awareness, I also tell the people in the society to join force with me because I cannot do it alone. I'm not the professor of autism, right? So there is the collective effort. There is the collaborative effort. So by the time, because there is power in teamwork, right? There's power in collaboration. So I throw that information out there and ask people to share, repost, and everything with the hope that it gets to the right people, which is the policymakers, the stakeholders, the people who make decisions in the society, right? And when I also encourage non-governmental institution, organization to also talk about it, do something about it, write something about it, where we all come as one, the policymakers begin to see it as, it's like you stating something continuously in my ears. One day you will give in, no matter how hard you think you are. You will say, okay, I get it. Let's do something. Let's have a conversation, right? But first, it has to start from, the passion from the people that, yes, are they ready for the change? When the people that are leaders see that people are ready for change through continuous awareness and pushing out the information out there, then they will begin to say that, yes, truly they need the change, because if they do not respond, the leader may not find it easy because you are a leader over us. And it's the government for the
Sure.
people by the people. When you define democracy, if it's still like that,
Makes sense. Makes sense. And so, as you move through this, it's got to be challenging because, like you were saying, you have to share this data frequently. You have to share it effectively. I imagine there's pushback. What keeps you motivated to continue down this path with all the obstacles that I imagine are in the way?
there is a saying that who knows it feels it the most, right? So I'm surrounded by a lot of people, friends, loved ones who have children with children on the spectrum. And I could see how that could impact their quality of life. And not just even that person on the spectrum, even their caregivers. So it impacts life. The stigma alone is it's not just something to be proud of. And so there's a lot of change in their lifestyle. There's a lot of change in the way they see things. Some just go into burnout situations. Some just believe that they're no longer accepted in the society. And so every day, autism is in my face. I see it from friends, from loved ones, and it gets into my head. And immediately I see it gets into my head, I push out, keep pushing out the information. So it drives it drives that passion. When you see the way your loved ones are not living up to their optimum health, not because they cannot, but because they are taking care of people on the spectrum. You will be touched to say, yeah, I want to join the forces as well.
When you mentioned the nonprofit and you're doing these amazing things globally, let's talk about the business side of it. How do you raise capital? How do you raise funding?
Unfortunately, no. I have not been getting zero. Let me use the word. I have
She's rich, Smiley. She's rich.
See,
No. Honestly, no. Please don't. Okay, so let me rephrase. I'm surrounded by people like I can easily convince people I have that gift. Okay, so I must be thankful to God for that. When I'm passionate about something, I would make sure I convince you to that thing. So that's what I've been doing. So I've been able to convince my loved ones. I've been able to convince people around that. Can't you see? Look at that. Look at this person. Did you notice that you didn't see this person? Do you know why you did not see this person? It's because the daughter, the child, this, that. They'd be like, okay, so what shall we do now? What can we do now? And then so they've been coming, like people have been coming, friends, just friends now have been coming to say, okay, like the program that I held, that was held in Nigeria for the autism program, 85% of it came from me, 15% came from my friends that I went to school together with back in Nigeria. Though they live in the States now, but the power of friendship. Now, the 85 portion of it was challenging on me because what that means is that I was having my feeding money, what I was supposed to be feeding on. So I've been saving up to make that program happen. So it means that I needed to reduce my ration. And when I say feeding money, it doesn't mean I'm feeding on it is even so cheap. Let me use the word. I'm doing that because of one thing, passion and the change. Now, the question is that the best way to do it? Maybe not. Or maybe it just remains in the gray area. But it has to start. I need to start from somewhere with the hope that people can see the evidence and come around and support.
I love that because if you got passion, which is desire on fire, that's what passion is. And when you have that desire and passion, you'll get it to happen. It becomes a primary obsession and it just gets done. So that's amazing. Is there any question that we should have asked you about?
I think I really want to use space to put information out there for more funding to be out there for any neurodivergence disorders that we have. I really want to put that there. That is very important. That's for sure.
So let's say someone wanted to reach out to you. Tell us how best to contact you.
Yeah, because the program is an ongoing thing. It's an ongoing project. So I have a website, Matermental.com. Matermental.com. I love transparency. Everything I do, I put it out there for people to see because that's my evidence. I don't have to speak too much grammar. I don't have to blow too much British English to tell you that this is it. So the evidence is out there.
I love it. I love it.
Hold on. She said British English.
English.
Woman.
Yeah, I love that. So Matermental.com.
.com. Yes, it is there. And you could be rest
Okay.
assured that whatever dollar you put in out there will be used for that cause. That's the truth. Because the one I did in Nigeria, there's too much demand. Even the school that I use, the special needs school, they have a whole lot going on in that school. So I had to make a 10-minute video where the principal of the school had to speak, where, you hear best from the Aussie's mouth. He will tell you, at least it's not coming from me. I have taken the passion. I have done the little I can do by addressing the dental portion of autism, because there are different aspects to it, right? So I had to make a video that, okay, the principal of the school, you tell us what is going on beyond, what I've come to do in the school, because it is not just about only what I've done. There is more to it. So that video is out there, and I keep resharing that. We hope that it will get to the right set of people, right? So more to be done. A lot of states needs to do more. And of course, when you have to do more, it entails human capital and the financial part of it, for sure.
Wow. Awesome. So Dre, let's move into the final four.
You ready for the final four here?
Yes,
All right,
sir.
let's do it. Right.
All
Let's
right,
do it.
Dr. Adeola, what is the best compliment you've ever received, and why?
The best compliment was, it was as simple as the word thank you. Thank you for coming on time. And the word is on time. Because in medicine, too, when we use the word myocardial infarction, it says time is muscle. If you don't come on time, that's it.
Dr. Folorunso, I like you said that. I irritate a lot of people because I believe early is on time is late is not acceptable. And so some people who are around me, they get irritated because, why do you have to be 30 minutes early? It doesn't start for half an hour. That's okay. The plane doesn't leave for 3 hours. That's okay. I'm here. If anything, I'm ready for the unexpected. So I agree with you. Early is on time, and being punctual, because it represents you and who you are. It says a lot about you if you're punctual.
Yes, that's right. Yes, that's right.
Okay, so next question. What's something that you wish you were better at?
I wish I could speak multiple languages, because I really want to reach out to so many people on a global health issue. And I need language, the power of language, to reach out to those people. So I wish I could speak all the language in the world.
How many languages do you speak now?
2.5. So,
That's 1.5 more than most Americans, because we barely speak English. So awesome. Here's a third final four for you. Alive or dead, who would you want to spend 24 hours with, and why?
I want to spend my 24 hours with people that know that vulnerable population. Yes. The reason is because we become vulnerable sometimes not because of what we did. It's just sometimes it's natural. So why would people suffer for the rest of their life for something that happened to them naturally? So I want to be there, even if I can't touch every aspect of it, but at least one aspect will begin to make the difference. And that's it. I don't want people to suffer forever for something they did not create. So the vulnerable population.
Dr. Folorunso, who is one person that you would like to trade places with for 24 hours?
I hope she can hear this. Michelle Obama. Yes. Right. I hope this information can get to her, Michelle Obama. Not because of her status, but because of what she has been through and how she made a good ending out of it, and what she's doing with it. She's giving message of hope. She's telling people that your background doesn't have to determine the way the whole of your life has to be. She preaches that message so well and delivers that so well and gives the word of hope. to people that you can do it, even if you did not start well. And if you didn't start well, you can always retrace your step again, right? So I love that. I love what she does, right? And so, and good for her. An excellent work that she was able to get into that spotlight in her life. But the track record that she has shows how genuine, how transparent, how caring and loving she is, that she really wants to reach out to everyone, most especially the vulnerable population, which I also love myself personally.
Yeah, as you share that, so a phrase comes to mind. It's not how you start, it's how you finish,
That's
right?
right.
It's not how many times you fall down, it's how many times you get back up. Her book is a great book for those listening and watching this. For if anyone is curious about Michelle Obama's first book, excellent book. Yeah, for those who may not have read it. Yeah, so thank you for sharing that. I appreciate it. Smiley.
Yeah, being on the Dre Smiley in a circle, your passion. You made me when you were speaking about. This is the first time where you said you wanted to, or we had someone not name a person. They named a whole population of underserved people. You said the most vulnerable. That made me think like you're an earthbound angel because your heart and passion to help so many is infectious and contagious. So I want to thank you for being on the podcast, one, and thank you more importantly for what you're doing in this hemisphere and on the other side of the planet and what you're doing globally. Because it just, I think of you when you wake up, you're not just thinking about a problem in one part of the world. You say globally, you want to affect change for all the underserved with autism and postpartum globally. That means your perspective is so much broader when you start off versus, I just want to help my little zip code here in Los Angeles or this little state here in Nigeria. You're looking at everyone. So thank you for doing what you do.
There is a principle in public health or population health where if you are able to, vaccinate a set of number of people in the community, then you begin to save other aspects to other set of people. So you want to increase the immunity of people. When we begin to increase the number of people, a vulnerable population who are having access to something. And by the way, access, like I earlier said, doesn't always mean ability to get to a place. Access could mean can I afford that? And can I sustain that? Affordability and sustainability, to carry on. So with the hope that we start from somewhere and it begins to expand, right? And people begin to see it. So I really want people to join the force that, when it comes to impacting life across the spectrum, you don't have to have it all figured out. Just start from where you are and with the hope that the fire catches and begin to spread.
Yeah. At the top, Dr. Folorunso, you said that your success is in part due to your family and circle of friends in terms of the support and the push for excellence. I can imagine how proud they are of you. I'm glad that you were able to take a few moments out of your day today to share with us the work that you're doing. For those listening and watching, I hope that you are able to spread the word in terms of what she's doing. For those that are able, please support her at Matermental.com. And thanks again for being on the Dre Smiley Podcast.
I would say thank you so much for giving me the opportunity and the platform to speak, because I could have so many things to say, but if there is no opportunity, it's just going to become a theory. So thank you so much.